Good morning, everyone, and welcome to the ADMS Compliance Department's webinar on HIPAA and HIPAA requirements. We will begin momentarily. Thank you. I'm going to ask everyone to please mute their phones. Good morning, everyone, and thank you for joining the ADMS Compliance webinar Wednesday for today, July 6, 2016. I'd like to thank those of you dialing back in due to the technical difficulties we experienced last week. Please note that this webinar is being recorded and will be posted on the ADMS website at www.atlanticdialysis.com within 2 weeks. Thank you. So why don't we begin? The Compliance Department and Regulatory Affairs Department is manned by 4 individuals at ADMS College Point: William D. Cundiff, Ricardo Sime, Carrie Richmond, and Alexander Osorio. Note in this webinar that the terms Atlantic Dialysis Management Services and ADMS in this educational program refers both to those specific organizations and to the contracted network of affiliated dialysis centers and physician practice locations that it's affiliated with. Let's talk about HIPAA, the Health Insurance Portability and Accountability Act. So let's get hip with HIPAA. HIPAA requires a number of different things. There are standards for both electronic transactions and code sets, and these went into effect in October 16th of 2003, and they're enforced by CMS, or the Center for Medicare and Medicaid Services. The standards for privacy, for individually identifiable health information went into effect in April of 2003 as well, and that's enforced by the U.S. government through the Office of Civil Rights, OCR. And the standards for security of electronic protected health information, or what's known as EPHI or PHI, that went into effect in April of 2005, and that's enforced by the Center of Medicare and Medicaid Services, CMS, as well. Our training focus today is going to focus on 2 aspects. One is going to be HIPAA privacy, and the other is going to be HIPAA security. And the trainings that you're receiving today will focus on learning what responsibilities you have in order to ensure that ADMS complies with both HIPAA privacy and HIPAA security regulations. And we're going to address the following topics briefly today in our 45 minutes. Under HIPAA privacy, we'll talk about protected health information, or PHI, the term minimum necessary and how it applies to your job, patient rights, privacy policies, the privacy officer, and the reporting of privacy concerns. And then under security issues, we're going to talk about electronic protected health information, or EPHI, the user identity, password management, appropriate use of computing devices, and security policies and reporting security concerns. Folks, if you'd be so kind just to mute your phones. Thank you. So let's talk about HIPAA privacy. And if anyone is not seeing the screen on their computer, please just shoot me an email in the lower right-hand box of the GoToMeeting. So HIPAA privacy, the HIPAA privacy rule protects information known as protected health information, or PHI. And that information exists either in a written format, an oral format, or an electronic format. Well, pardon me. Let's see what we have here. I just want to make sure you're seeing the presentation. Okay, let's see there. So examples of protected health information, or HIPAA privacy. So some of the examples of that would be a name, a birth date, a fax number, an account number, or a patient ID number. Check now, Noma. An account number, a web universe resource locator, or URL, an individual's street address alone without city or state, a patient's admission date, an electronic mail address or an email address, any type of certificate or license number they may have, the patient, his license plate number or her license plate number that you put on a log sheet when the patient shows up, a city, a patient's discharge date from a dialysis center, of course their social security number, SSN, any VIN number, a vehicle ID number, a police precinct, a date of death, a medical record number, any IPN or Internet Protocol number in order to track computer usage, an obvious full-face photographic image, a person's zip code, a telephone number, their health plan ID number, any biometric identifiers like fingerprints or anything along those lines, or an iris scan, retina scan, and any other unique identifying number, characteristic, or code. This is a pretty all-inclusive set of HIPAA privacy and examples of protected health information. Okay. Under the HIPAA privacy rule, the privacy rule limits the way in which members of the ADMS workforce, that's employees, that's privileged staff, those are physician owners, and consultants, may use and disclose protected health information. Folks, I'm going to ask whoever's there, put me on speaker. If you can mute your phone, please. We're getting background. Thank you. The ADMS workforce must have a job-related reason to use and or disclose PHI. The privacy rule also requires that ADMS workforce uses only the term or the minimum amount of PHI necessary to get the job done. Okay, and this is what HIPAA defined as the minimum necessary standard. Okay, and again, with respect to the workforce within the ADMS environments, that means our employees. If you have any volunteers or student workers during the summer, any new employees or trainees, any other persons who conduct work for ADMS, such as consultants, who are under the direct control of ADMS and whether or not they are paid by ADMS. So let's talk about the minimum necessary standard, and let's put this out there. And I'll ask you just to think about this for a few minutes. So we got a request once to the compliance hotline saying that a patient I cared for in my dialysis facilities was transferred to another ADMS facility. Can I look in QCS and peek at the patient's record to see how she's doing? Can I call the unit and talk to the social worker? So before we go on to what the correct answer is, I'll let you folks think about that for a few seconds. So you work for ADMS, you deal with them, you deal with the dialysis center, the patient transfers to another facility, and now you want to go into QCS and check on them. You know, how's that patient doing? How are they doing? Can I call? Maybe I'll talk to the social worker. I know the social worker at Broadway. Let me chat with them. So under minimum necessary standards, as much as this may reflect your compassion and concern for the patient who may have taken care of in the past, you are not permitted and may not inquire into her status unless there's a job-related reason. Okay, for example, if you have to complete a note in the patient's medical record after she's left the unit, then you can access the medical record to complete the note. But just to access the medical record for purposes of just checking, let me see how he or she is doing, that's impermissible under the minimum necessary scenario. Nope, that's not slide working, so let's keep moving. Under patient privacy rule, the privacy rule provides patients with certain rights, and these rights are commonly referred to as their patient privacy rights. If any patient wishes to exercise any of the patient privacy rights, which are outlined on the next slide, it has to be in writing. We do not accept, the compliance office nor the dialysis center should not accept any request for any documentation or anything related to patient privacy orally. It should be in writing, and they should be contacting Alexander Osorio, our compliance auditor, at 347-312-3038. So some of the patient privacy rights. One is obviously their right to access their protected health information. Okay. After they reviewed our protected health information, they want to make a modification. They find something is incorrect. They want to make a change to it. Well, they have a right to request an amendment to that PHI. They also have a right to request restrictions on how we use PHI for both treatment, payment, and healthcare operations. They have a right to receive confidential communications. They have a right to request for an accounting of disclosures. What the ADMS Compliance Office does, it puts out a semi-annual PHI disclosure log to each of the affiliated dialysis centers. These come up at the governing body meetings. I know there's some compliance officers / nurse administrators on the call. You will receive at your governing body meetings, as part of disclosure, a PHI log, which will tell you what requests we've received for the last 4 to 6 months, what requests have been filled, and what requests are still open for whatever the reason happens to be. And a patient also has a right to complain to the Department of Health and Human Services and the Office of Civil Rights. The privacy rule requires that ADMS designates someone who's responsible for the development and implementation of privacy policies, the privacy-related training and education that's done by ADMS Compliance, that someone investigates privacy-related complaints, and that there's a conducting of routine audits to make sure that all of the ADMS workforce are complying with privacy policies. And the privacy officer for ADMS Corporate is William D. Cundiff. So let's talk about some of the privacy compliance tips that we recommend. Keep all PHI locked and secured when you're away from your work area. ADMS billing and collections folks, at the end of the day, leave lots of paper out. File cabinets are left open. We know that. So keep all that information locked, put it away in your desk, put it back in the file cabinets from where it exists. Nurse administrators / center compliance officers, same situation. Make sure your staff members don't leave PHI-related documents. And again, a recommendation from the ADMS IT director is that everyone log off their computer at the end of the evening or the end of the work shift when they're leaving for the day. Do not include any patient identifiers in the subject line of any email. Don't put a person's name. Don't put their login account. Don't put their beneficiary ID number, their dialysis center, their date of birth, any of those PHI identifiers. Don't put that in the subject line of an email. Don't discuss PHI in the public or common waiting areas, hallways, bathrooms, lunchrooms, kitchen lounges, anything like that. And when faxing, please make sure you check the fax number for accuracy before sending a fax that contains PHI. At the same thing, I'm going to say, please make sure that before you send out an email, make sure that you have the correct email address for accuracy before sending an email that contains PHI. We do have one situation where an individual did email a whole series of patient and employee records to an unrelated third party. They put a bad email address in. They actually scanned it directly into the scanner copier at a location, and they scanned it to an unrelated third party who ended up calling the ADMS Compliance Office with concerns about patient privacy. The security rule. Security rule requires administrative, physical, and technical safeguards be in effect and be implemented to address the confidentiality, integrity, and availability of electronic protected health information, or EPHI. Once again, folks, please let everyone know within your facilities and your corporate offices that security of patient information is everyone's jobs. At the very least, we owe it to the patients. Again, comments or questions regarding HIPAA and the electronic PHI and electronic rules should all be directed to the ADMS IT Director, Victor Paris. The security rule requires that ADMS provide each computer system user with a unique user identifier. And that user identifier is a combination of your user ID and your password. Don't share the password. Don't write down the password where it can easily be retrieved by someone other than you. If you look down at a desk right now or walk around your facility or corporate office, you will see passwords written on Post-it notes left on the desk. They are taped to the side of your computer. I know that because we see them all the time. The ADMS IT department lets me know when they go around the facilities. So those of you on the call, please remove those Post-it notes with all your ID numbers and everything else listed there, please. Your user identity is what's used to monitor the activity on the system. So the IT department knows exactly where you're logging in and what you're logging into. Okay? Do not leave yourself signed on to a computer and then walk away without signing off. You are responsible for any activity that occurs under your user identity. And your user identity appears on audit reports, which are monitored frequently. So how do you protect your password? In order to protect against unauthorized access to our computers, ADMS has taken appropriate steps to monitor all activity on the network to ensure that people are not trying to break into the systems. However, as a user of the ADMS system, it's important to take measures to ensure that people cannot access your ADMS system, and this is partly accomplished through the password management. Now, password management includes selecting a strong password, okay? Then protect that password, and then frequently change the password. As someone once said, a password should be like a toothbrush. Those of you who brush your teeth hopefully will understand this. Use it every day, change it regularly, and then don't share it with any friends or pets. So how to create a strong password. And again, I'll defer to the ADMS IT director on this, but some of the items, this is what we use within the ADMS compliance office. So first off, mix your upper and lowercase characters. And you'll see 3 or 4 examples there. Replace letters with numbers. So if your nickname is Cheech, C-H-E-E-C-H, change it with C-H-33-C-H. Or special, as you see, replace the E in special with a 3. Okay. Combine 2 words using a special character. Maybe you have a nickname back in the day when you were a youngster running around through the schoolyards in Brooklyn. So it can be something, as you see, rooftop or batter up or sugar daddy for those of you who live in a wilder life than the rest of us. Or use the first letter from each word of a phrase or song. Like, oops, I did it again becomes O, exclamation point, I-D-I-A. In general, passwords should have a minimum length of a certain number of characters, but each application, whether you're going into QCS, whether you're going into the email server or anything else, may have other requirements or limitations. Speak to your dedicated ADMS IT employee assigned to your facility or site, or contact their IT director. So the security rule requires that ADMS train its workforce on appropriate computer security and the appropriate use of computing devices. So as a user of the ADMS system, you're required to make sure that you use only your officially assigned user ID. Do not provide your friend, your neighbor, because he or she do not provide them access. There is a way in which the IT department can track who's in the system and who's made data entries. There are tracking mechanisms to understand if things are being entered in the system, who made that, so it can all be tracked to you or to your ID. Save ADMS data only to the ADMS network unless, save your ADMS data only to the ADMS shared network unless you have prior ADMS approval not to. Essentially, don't save everything to your desktop or to your laptop and not to the shared drive for a couple of reasons. One is security, and your laptop desktop could be hacked. Number 2, if your system crashes, that information is going to be unretrievable. So that master spreadsheet you've been working on for the last 6 weeks can no longer be identified. All those Medicare claims rosters that you've been preparing, or all those checks you've been issuing and cash receipts you've been monitoring, you cannot find now because you saved it to the desktop laptop and not to the shared drive. So there's a security system and there's an access reason for that. And again, notify your manager and the IT director if your password's been disclosed or otherwise compromised, or immediately change your password. Once again, folks, those Post-it notes taped to the side of your computer or put to your desk or written on your desk pad, and I know it because I'm looking at my desk pad myself. Don't put your passwords on those desk pads. Don't put it on the Post-it notes to the side of the computer. Okay, so HIPAA security, the do-nots when using the ADMS system. As a user of an ADMS system, including the internet, you may not install unauthorized software, such as screensavers, games, or any type of instant messenger programs like Yahoo. Don't install any unlicensed software on an ADMS computer or a device. Don't abuse your internet or email access privileges. Don't relocate any computer equipment without prior IT department approval. And do bring into ADMS any personal computer, or don't bring into ADMS any personal computer equipment without prior IT department approval. Your printer doesn't work at home. Your CD burner doesn't work. You know, Victor, Richard, can you check out my scanner or my digital camera? Don't bring those in unless you've got some prior approval. Okay. The security rule requires that ADMS establish a way for all ADMS workforce to report security concerns. Those of you who are administrator or have operational responsibilities at the center, again, the ADMS workforce includes your employees, your consultants, your privileged staff members, and your physician owners. Let me repeat, your physician owners have no special privilege. They are not on a flying carpet. They do not sit on a smoking cloud. They are not high above everyone else. They are treated with the same mechanisms and the same policies in place as everyone else. If you have a concern or issue about a physician owner or a privileged staff member and he or she is pulling their weight and pounding their chest, please call the ADMS compliance hotline at 718-483-7403. Report all risks you are currently aware of. And as you see them, let us know, such as, again, an unauthorized or a suspicious visitor. Okay? You see a computer logged into, but there's no one there. Okay? You see uncontrolled access to areas that house the equipment and or PHI. server rooms, computer rooms, your patient log rooms where you keep patient records, passwords on Post-it notes, or staff accessing records without a need to know. As you know sometimes from listening to the news and watching the news, and I am an adjunct professor and I teach health law at a law school, one of the things we always talk about is employees within hospitals and healthcare operation facilities who access patient records for generally those who are famous, so to speak. When Farrah Fawcett died, there was a nurse who accessed her record, her medical record after her death, 152 straight days. They were sure that things were printed out. So if you see someone accessing records and it has nothing to do with them, maybe, sometimes people see friends and you say, oh, let me see what Mary's got. Let me go check on her. Let us know if someone's accessing records. Report it to your staff administrator, your nurse administrator. Report it to the ADMS ID director, or again, call the compliance hotline. Okay. For more information, and we're coming close to an end here, but for more information or to schedule a live presentation at your location or to discuss any part of the compliance program in general, contact the ADMS Compliance Officer, William D. Cundiff, at 718-483-7428. We're going to go to question and answer in a few moments, but let me just let you know the next webinar Wednesday on compliance training is scheduled for July 27th. That'll be at 2:30 p.m., and it's going to be on BYOD, bringing your own device to work, and how using your own device in the healthcare workplace can be dangerous. And the presenter is still to be identified, but it is scheduled for July 27th at 2:30. So at this point, I'm going to open it up. I'm going to ask everyone if you have any questions to put it in the chat screen, or type it in on the chat side in the lower right hand, and we'll begin. We'll give it a few seconds to get some questions in. I see I've got a couple coming in. I just want to copy and paste them, and then we'll begin. So our first question is, what am I supposed to do when I receive a medical record request from a law firm or government agency? And this happens often, and the ADMS Compliance Department, we see emails all over the place. When you get a request from a law firm or a government agency, CMS, from a requester, what you should do is, first thing is, scan that entire letter, the record request, the envelope, scan it to myself and also to Alex Osorio, the ADMS Compliance Officer. Alex is responsible for the PHI disclosure log and releasing information. What Alex will do is, once he receives that document in hand, he will invoice the requester. Private requesters, such as law firms who are requesting medical records on behalf of people they may be representing, by statute, by law, ADMS can bill on behalf of the dialysis center up to 75 cents per page for your staff's time to copy, for your staff's time to prepare the documentation. Generally, what we'll do is we'll receive this letter, we'll prepare an invoice based upon a request. I'm sorry, let me go back. We'll receive the letter. Alex will then speak with the nurse administrator and get an approximate page count. Patient record X is going to be 1,000 pages. What Alex will do is Alex will then send an invoice to the requester at 75 cents a page. So he'll send an invoice for $750. Once that $750 is received, then what will happen is Alex will then put a request in to the administrator or whoever the person at the dialysis center was who received the medical record request to make the copies. Once those copies are complete, those copies are sent to Alex, and then Alex will send a distribution out, and he will advise when that occurs. If it's a government agency like Medicare or an insurance company, those are unpaid for requests, meaning that as a condition of participating in that payment schedule, there is no payment necessary. All they need to do is request them because United Health Plan is paying for services rendered for patient X, and therefore we'd like to see the medical records on the state. As a condition of participation with United Health Plan, as an example, all they need to do to request, Alex will advise you to make the copies, send it to him, and all PHI requests will go through Alex directly. I've got another question here. Are there records kept of PHI disclosures? And we've talked about this in the past. And the records kept of PHI disclosures are, we do keep a PHI disclosure log. And that PHI disclosure log, as I mentioned earlier, was to Alex Osorio. And what Alex will do is, based upon the requests coming in, both fulfilled and unfulfilled, we'll maintain those, and then we'll present them to the governing body and ownership. First thing you do before we release any records is make sure that there's a proper authorization signed off by the patient or the patient's legal representative. So we've got another question here. A woman wants to view her husband's medical records at the dialysis facility without him knowing about it. She's coming on Tuesday next week to pick him up. Where should we do this? Well, you shouldn't be doing this at all. First item up is that a spouse, unless there's a legal declaration or a legal document indicating so, a spouse has no privity for a patient's medical records. So your husband or wife, depending on your personal situation, unless you've got a legal document providing that individual authorization and legal authorization to access those records, that individual has no right to access your medical records. So there should be no discussion with that individual. And those questions or comments should be referred to the ADMS compliance officer at 718-483-7403. One question just came up here, and what action may be taken when a password is shared an employee to another employee? ADMS compliance office does not get involved in human resource related functions. If it has been identified where there has been a sharing of employee identification or passwords or logins, that information is referred to the ADMS IT director and to the ADMS human resource director, and then they will determine what the appropriate action is, depending upon what information that individual accessed. I'm going to ask if you can please mute your phone, whoever that is. Thank you. I'm going to, depending on the severity of the information accessed, the degree it's been accessed, and how often, there may be a recommendation from the ADMS compliance office to do a write-up, maybe just have a conversation with the employee. It could range to a disciplinary action, including a suspension, or if it's egregious and quite severe, it could be nothing. Could be as much as a request of termination. But again, those are just recommendations by the ADMS compliance office. We do not have authority to take any personnel action. That would stem with the ADMS HR director as well as the ADMS IT director. Any other questions or comments? With that being said, we're going to conclude today's monthly webinar on HIPAA. Again, the next webinar will be scheduled for July 27th at 2:30 on bringing your own device to work. This information, again, this webinar has been recorded and will be placed on the ADMS website within 2 weeks. Please check with your ID manager or call the ADMS compliance office if you have any further questions or comments. Thank you, everyone, and have a great day.